Thank you, Senator Marshall.
Thank you, Madam Chair. Dr. Linton, how many babies have you delivered in the past month or two?
I would say probably in the 10s to 20s.
Okay. And Dr. Verma, how many babies have you delivered in the past month or two?
That's a good question. I'm terrible at estimating, but over my carew, thousands.
But you're still active. You're still actively delivering babies.
Oh, yeah. I do
have a
labor and
prenatal
delivery
clinic.
shifts every week.
How often or what type of range would you do sonograms on a pregnant woman, let's say before their 4th month of pregnancy? Hardly ever, a lot, sometimes.
So yeah, I see patients with all kinds of pregnancies, and usually when a patient comes in and has a positive pregnancy test, I talk to patients that want to continue
My
those
question is, how
pregnancies.
often do you use sonograms on your routine prenatal visits before 16 weeks or so?
We usually do an initial ultrasound to confirm that the pregnancy is there.
For
to
prenatal
confirm it.
pregnancy, first visit, usually you're doing a sonogram to confirm the pregnancy. Dr. Linton, how often
Depending
are
on
you
how
doing
far
sonograms?
along they are, yeah.
In the first trimester or early second on a routine OB situation?
So to be very clear, I work on labor and delivery and I deliver babies, but I do not provide prenatal care.
Thank you. So then, Dr. Linton, have you delivered a 23, 24-week baby, I'm sure, before?
Yes.
Yeah. When that baby's delivered, you call in anesthesia, you call the NICU, you call everybody you can in to help that baby, right?
Depends on the clinical scenario. But yes, if it's a desired pregnancy and the patient has voiced the desire for resuscitation, then we have NICU present at that delivery.
And you've also done abortions at 23, 24 weeks as well?
In my training, I provide the standard of care in line with medical
I'm
laws
just
for the
asking,
state
have
that
you
I'm
done,
living in.
I'm sure you're not ashamed of it, you've done abortions with the baby's 23, 24 weeks?
I provide the care that I'm trained to do based on the state laws where I live in.
So, and Dr. Verma, you've done abortions and you've delivered babies at 23, 24 weeks, full resuscitation. At the same time, you've done abortions on those as well.
I think what you're highlighting here is the complexity of what we do.
No,
what
no,
we
that's
do
not my
is
question. I
very
get to ask the questions here. I'm
complicated.
not asking for a lecture. How do you, is there any distress in your mind or your heart after doing an abortion? On the one hand, you're delivering a baby at 23 weeks and it's full bore, all out, resuscitate the baby. You feel horrible, it doesn't make it. Then you do an abortion on that same, how does that make you feel?
Yeah, no, I appreciate the question. I think it's a great question. And again, like I was saying, this is why this is so complicated. I feel that complexity. Like I said, I've experienced a first trimester loss myself, and I found that loss devastating. So this is complicated, but I also know that my patients are able to make these really complicated
you so much. Thank
decisions
you.
about their health and
Dr.
lives.
Linton, what pregnancy category of drug is mifepristone?
I'm sorry, Senator, off the top of my head, I can't tell you the class.
Dr. Verma, you know what type of pregnancy category drug mifepristone is?
I know mifepristone is incredibly safe based on decades of data.
About misoprostol, do you know that what category of drug that is in pregnancy?
I can tell you we use misoprostol for a variety of reasons, including in desired pregnancies on labor and
Understand that.
delivery every day.
So they're both category X drugs, okay? I'm going to tell you the answer. They're both category, so y'all are prescribing these drugs and you don't know what category of drug it is. And why is it a category X drug? Because it causes fetal malformations, right? So it causes fetal malformations.
And those
Right.
categories that you're describing are actually based on politics. The mifepristone is safer than Tylenol,
But you're saying the
Viagra,
FDA
multiple.
is based upon politics. The FDA is saying this is a category X drug. Would you agree with me that these abortion pills are less effective at 14 weeks as opposed to 8 weeks, Dr. Lindman?
Dr. Linton, yeah, I would say that our data does support with increasing gestational ages that sometimes we have to modify the protocol, but generally
effective.
they
They're
are
less
more
effective.
effective at earlier gestational ages
Right.
depending on the protocol
So
you
what I'm
use.
confused about is and I've never prescribed this drug. I've taken care of lots of patients that have complications from these drugs. I'm confused why you do a sonogram in a routine pregnancy to establish gestational age. That's the main reason you're doing pregnancies in the first trimester, early second trimester, because the spine's not developed, heart's not developed. So you're basically doing it for gestational age. You're recognizing that so many women come in and they're a month off of their gestational age. So why wouldn't you want to do a sonogram on every person you see before you prescribe this drug, realizing that it has decreased effectiveness at 14 weeks than 10 weeks. So therefore, you're prescribing a category X drug to a pregnancy that's probably not good, that has a possibility of not being aborted. So you're increasing the risk of fetal anomalies. It just doesn't add up to me. Why are you scared to do a sonogram? Wouldn't you think if you were doing an abortion procedure on a 12-weeker versus a baby that's actually 20 weeks, that it would change everything? I'm just appalled that why you all are so afraid of doing sonograms. Thank you so much, and I yield back.
I'll allow you time. I'll allow you time to answer that question, Dr. Verma.
Thank you. And I will say, as a doctor who actually does provide this care to patients and is currently practicing, we actually often do sonograms if there's any questions. So when we see a patient and we're providing medication abortion via telemedicine, we go through screening questionnaires, and if there's any concern, we absolutely do a sonogram. So that isn't really an accurate representation of how this practice of medicine works.
Thank you.